I'm very pleased now to be joined by Professor Ashwin Kumar, Director of Research and Policy for the Institute of Public Policy Research. Professor Kumar, thank you so much for joining me. Have we got to the point where fundamental reform is needed and that just pouring more money in and trying the same things that have been done over recent years isn't going to solve the problem?
Well, we do need a pretty serious reform, but I do disagree with your characterisation of lots and lots of money being thrown at the NHS. If you look at Lord Darzo's report, which came out only recently, what he found was that between 2011 and 2018, actually the NHS was provided with extremely modest increases in funding and actually not sufficient to account for the fact that the population is getting older and there was more need in the NHS. There were more recent increases in funding, you're absolutely right, since 2018. But interestingly, the capital budgets and the public health budget wasn't increased in the same way. And one of the things that Lord Darzo found was that because the NHS was actually suffering in terms of shortages of day-to-day running costs, actually we weren't spending money on the technology we need in hospitals. Buildings are fraying, we're not using the latest tech. So one of the things that we've got to do is not have year-to-year budgets where managers aren't able to plan what they're going to get in terms of their funding, but they're able to invest in newer technology to anticipate the needs of the future. Because that's one of the reasons why the NHS is not as productive as it should be. Because actually we've got staff struggling with old-fashioned kit, not using the latest technology, when we see that in our appointment systems. There are all sorts of ways in which we should have been investing in better technology and better kit in the NHS.
But we are spending similar amounts of money as a percentage of GDP as countries like Australia, like Switzerland even, which have better outcomes. That's why I'm suspicious of this suggestion that it's all about money, that those countries are doing better with proportionately similar amounts of money.
So there are, I think, a couple of things to think about. The first is that we have a lot of things that are gumming up our system so that the money isn't being spent effectively. One of those is the problems in social care. So Lord Darzo highlighted the fact that actually we have quite a lot of beds in NHS hospitals that are being used up by people who don't really have to be there. And so we need to get that interaction between the healthcare service and the social care service right, so that we're not spending money looking after people in hospital when actually we could be spending it on other patients.
But that's a really interesting part of organisation. I was very struck that I used to represent North East Somerset, and the Bath Royal United Hospital had at one point 130 patients who ought to have been in social care, about half from Wiltshire and about half from Bath and North East Somerset. Bath and North East Somerset managed to get theirs down, if I remember rightly, about 20, and Wiltshire didn't. And that the organisation of local councils outside the NHS is one of the big stumbling blocks. But again, that's not money, it's organisation. Bath and North East Somerset could do it, Wiltshire didn't.
Another way in which we can think about this, which isn't just about money, is about whether or not we're spending the money on primary care and prevention. For example, we don't have much of a tradition in this country of having regular health checks, of finding out about conditions in advance. So what happens is that people get more ill, then they go to the GP, then they need more specialist care, which is more expensive. And so one of the things that's happened despite the fact that the government has said that they wanted more money to go to primary care, actually the money has been going to hospitals because, you've got need in hospitals, you've got waiting lists, okay, we've got to put money there. But actually getting some of this money into prevention and to primary care will mean that we'll be using the money that we spend more effectively.
All right. Well, thank you very much, Professor Kumar, for sparing the time this evening with us.